Okay, thank you all for coming this morning. Today we are joined by Health Minister Brad Hazzard, Dr. Kerry Chant, our Chief Health Officer, Deputy Secretary of New South Wales Health, Susan Pearce, the Secretary of the Department of Education, Georgina Harrisson, as well as the New South Wales Chief Psychiatrist, Dr. Murray Wright. Can I begin by thanking our health workers right across our state who are doing an inspirational and amazing job during these challenging times, as they have been over the last 2 years, in keeping people safe in our health system, whether it's our doctors, our nurses, cleaners in our hospitals, our paramedics. Everyone has been working incredibly hard day and night in keeping people safe. And on behalf of everybody across our state, can I thank you once again for everything that you are doing, not just over the last 2 years, but obviously particularly during the Omicron outbreak. In addition to that, can I thank our teachers who this week are getting ready for another year of school. It's been obviously a disruptive year in our education system in New South Wales and around the country over the last 2 years, but they're doing an amazing job as well as we prepare with the school plan that we've put together, which Georgina Harrisson will once again speak to today. And I want to thank our parents for their patience. For the last year or two, many parents have had to homeschool, and we know that as we go through this next period of time and getting kids back in the classroom on day one, term one, that there will be disruption. There will be issues that come through as we move through this period of time. But from a New South Wales government perspective, we have put together incredibly strong plans. We have resourced those plans, we've invested significantly to ensure that we can have kids back in the classroom on day one, term one, in a safe way. In a safe way for parents, for students and for teachers. And I know that there are many parents across our state who are anxious. And that's only natural in circumstances where we've had a disrupted schooling over the last 2 years, but there will be less disruption under the plans we have in place. We have ensured through the rapid antigen tests that we've procured and have been sending out to schools right across New South Wales, from Balmain to Burke, right across our state. We've ensured that those tests are available to keep our schools open, to keep our schools safe, but particularly to instill confidence in our parents. In our parents, that the school environment that our kids will go back to over the course of this year will be one which is safe for our students, safe for our teachers, and we know, and the Chief Psychiatrist today will speak to it, the importance of having kids back at school. It is essential, not just for their educational outcomes, but for their social outcomes and for their mental health. We've had many students in New South Wales and right across the country who have missed much face-to-face learning over this period of time. Some kids, up to a quarter of their schooling, they have missed during this period, and it's essential we get them back into school. I want to once again thank the Victorian Government. I was on the phone to the Victorian Premier last night, again in relation to the work that we've put together to ensure that both major states here in this country have similar plans. We've learned from each other. We've put practices in place to ensure that the environments that we have our children, both in Victoria and New South Wales, going back to school is a very safe one. As I've said, our key priority has been to ensure that as we move through this period, we have kids back in the classroom, and as well that we bring back as quickly as possible non-urgent elective surgery. We put a pause on that as we did during the Delta and Alpha outbreaks. I want to thank people for their patience. This is surgery that should occur in over the 365-day period. We want to have that non-urgent elective surgery back as quickly as possible. We've set out a day of mid-February, and that is our commitment to maintain that date. It's very pleasing to see where we are tracking in respect of the hospital system in our state. In New South Wales, every Friday, as you'd be aware, we provide that tracking about where we're sitting in relation to those scenarios, and we are currently tracking better than our best case scenario here, and that's because of the significant investment that we've made in instilling capacity here in the New South Wales hospital system. But as we move through, we want to maintain that cautious approach as we continue to get our booster program moving. So the restrictions that we have put in place last year, we will be rolling over for another month. This is a cautious approach, a safe and measured approach as we move through this next phase, and also ensures that we continue to instill confidence, particularly in our parents, and sending kids back to school. And as mobility increases, as Dr. Chant has said, we will expect cases to rise. So this is a measured approach, proportionate approach to the situation that we are in here in New South Wales. So as you'd be aware, those changes, those restrictions that will be rolling over for this period include density limits of 2 square metres, wearing face masks indoors, no singing and dancing in hospitality venues. These measures are proportionate, but particularly, taking a cautious approach as we move through and really focus on getting kids back in the classroom on the first day of school this year in a safe way, and as well making sure that we get that non-urgent elective surgery back. The other recommendations we continue to make, and I want to thank people right across New South Wales for the efforts they're doing. If we can gather outdoors, please do so. The social distancing, which we have been promoting, everyone is making an enormous effort, and that is very clear based on where we sit today and the results that we're seeing right across the state. There is a lot of evidence that shows that we should all be reassured across our state and across the country about where we sit, and it's very pleasing, that position. But the one thing I'd continue to ask today is we continue to focus on boosters. Booster shots are key. We've had about 40% of people across New South Wales who are eligible for that third dose booster shot have gone out and received it, but we need to continue that effort as we move through this next phase. Obviously, as you know, those booster shots are available in our 40 hubs across the state, supporting the GP and pharmacies, but we really need to get that booster shot rate higher. And we've seen the efforts that people have made. As the Health Minister says, when we're in those meetings many months ago, we never believed in this state that we would get to a position where we'd have a 95% vaccination rate, but boosters are still key. Now we know that obviously when there's concern and questions being asked, and Dr. Chant will speak to this, in relation to those people who have had COVID, when they're eligible and when they can go out and get that next booster shot. Today we'll be saying it's very clear that that date is 4 to 6 weeks. So within 4 to 6 weeks of you recovering from COVID, you can go out and get that booster shot. We have capacity in our hubs, our 40 hubs, to be doing 250,000 booster shots per week. We still have capacity in that system. We're having many GPs now having extra capacity as well, and obviously pharmacists. So I know many people have been on their summer break, but if you can come back, start the year well, please make that booking. There's plenty of bookings available across our state, in our hubs, through our GP network and pharmacists. If we can do that, that's the best thing that our state, our people can do, as we have done in the past. And that's why when you look at all the evidence, when you look at figures where Australia sits compared to the rest of the world in terms of hospitalisation, ICU and death rates, we have been incredibly successful here in our state because of the efforts and sacrifices that people have made day in, day out. But vaccination has been key in putting downward pressure on the hospital system and putting downward pressure on ICU admissions. So key message today is if we can continue to make that effort, it will ensure that we maintain the success that we've had over the last 2 years. I want to thank everybody for the efforts and sacrifices they have made during this period of time. It ensures that New South Wales continues to stand strong. It ensures that we can get back to normality as quickly as possible, that we can get kids back in the classroom on day one, that we can bring back that non-urgent elective surgery. And can I thank everybody as well for the unity they're showing right across our state, continuing to treat people with kindness and respect. These are enduring values, particularly as we come into Australia Day tomorrow and celebrate everything that makes our country great. I think in what's been a very challenging 2 years, tomorrow is an important day to celebrate those values that we've seen our people display over the last 2 years, and particularly during this period of time. I'm now going to have Dr. Chant provide today's public health update. Minister Hazzard will reiterate those messages in relation to vaccination and boosters. We really need, as I said, to continue that effort across the state. Susan Pearce will then give an update in relation to non-urgent elective surgery, as well as the hospital system here in New South Wales. Georgina Harrisson will then provide further updates in relation to the progress of the back-to-school plans, which I said has been a military operation here in our state and is going incredibly well. And I want to thank once again, all the people in the Department of Education who volunteered their time to get those rapid antigen tests out. It's been a phenomenal effort from everyone who's involved. So Georgina will speak to that, and then the Chief Psychiatrist, Dr. Murray Wright, will speak to the importance of kids getting back to school.
So as the Premier has said, it's pleasing to see that over 95% of people aged 16 plus have had one dose of the COVID vaccine, and 93.9% aged 16 plus have had 2 doses of the vaccine. We've got 82.7% of children have had their first dose and 78.3% have had their second dose. Please, we really encourage parents of those children aged 12 to 15. It's sort of been stubbornly sticking around that level, so please take the opportunity this week before school commences to have your children vaccinated. We've got 28.7% of children aged 5 to 11 years having had their first dose, and our booster rollout continues with close to 40% of the eligible population having received a booster dose. We currently have 2,943 people in hospital, including 183 people in ICU, of whom 72 are ventilated. Of the 18,512 positive tests returned, that includes 9,090 positive rapid antigen tests and 9,422 positive PCR tests. We've got 9,422 positive PCR results from 57,516 PCR tests. So thank you to the community for both embracing that PCR testing and the rapid antigen testing. Sadly, New South Wales Health is reporting the death of 29 people with COVID, 16 men and 13 women. And can I express my sincere condolences to the families for their loss. Of the 29 people, 5 people were aged in their 60s, 3 people were in their 70s, 14 people were in their 80s, 6 people were in their 90s, and 1 was more than 100 years old. 2 people had received 3 doses of the COVID vaccine, 21 people had received 2 doses, and 6 people were not vaccinated. The 1 person that was under 65 was not vaccinated and also had serious underlying medical conditions. For those with underlying health conditions, I just want to acknowledge that it's been a difficult time throughout the pandemic and a difficult time recently. But can I re-emphasise that booster doses will give you significant additional protection against severe disease and reduce your risk of acquiring symptomatic disease. During 2022, it will be important that we balance our focus on COVID with the focuses on other chronic diseases to support your overall health and well-being. So can I encourage you at this time to take the opportunity to exercise outdoors, catch up with your friends in outdoor settings. It is also important that we have a responsibility to help those most vulnerable, and that will be the elderly and those with underlying chronic diseases. So we have a part to play, and by getting boosted, we in turn protect those we love around us, and also continue to do those COVID-safe practices, which is make sure you're not out and about when you've got symptoms, keep those indoor masks, and choose the best environment to spend time with your vulnerable and those with underlying health conditions. We also just wanted to address some of the concerns that we've picked up from either social media or through speaking to various groups, and just probably a couple of the issues. There's been some comments that side effects are incredibly severe with the third booster dose, and that might be putting some people off. Can I just tell you that the side effects are short-lived, but the protection it affords is incredibly important. So please do not be put off. And the data, actually, the AusVax safety data, which is the national safety monitoring data, shows that in fact there's a similar profile of side effects such as those local reactions, that bit of that sore arm, with the booster dose as with dose 2 of the mRNA vaccines. So, and actually less people report needing to take sick days or miss work or stop their normal activities after the booster dose. So I just want to acknowledge some people will have sore arm, they might have a bit of a fever, they might feel a bit tired for a day or so, but it's very short-lived, and it's incredibly important that additional protection afforded by the booster. Also, just to reiterate, we've had a lot of questions about when people should get vaccinated. And I think I've said in repeated press conferences that, the general guide would be make sure you're well recovered from your COVID infection before you get the booster, generally 4 to 6 weeks. But please, if you've got any concerns, talk to your doctor about the interval that's right for you, if you've got any lingering fatigue. So 4 to 6 weeks is the general recommendation after you've had COVID, but in certain circumstances where you've got any concerns, please discuss your circumstances with your GP.
Thanks, Premier and Dr. Chant. Today is precisely 2 years since we had our first COVID cases here on our shores in Australia. And I think we've been through hell and back along the way, but we have actually, I think, had the benefit of being the lucky country, and particularly lucky in New South Wales. We've had the vaccines developed, we've had an incredible health team at our front line who've kept us all as safe as we could possibly be. But we all do have a responsibility, each of us as individuals, to try and make sure that as we move forward, all of us are kept safe. Now, the boosters are absolutely crucial. I know, I think, sadly in the passing of Meatloaf, but I know those words, 2 out of 3 ain't bad. Well, actually, 3 out of 3 is best. We need to go and get the booster. And if we can get the booster, what that does is really provide the protection against, or it minimises the opportunities for transmission, it minimises the opportunities to become seriously ill, it minimises the chances of ending up in intensive care. So please go and get the booster. Dr. Chant just talked about the fact that somebody who has caught COVID can go and get their shot, their booster, 4 to 6 weeks later. But of course, if you haven't had COVID, but you've had your first 2 shots, well, you can have the third one in one of our state facilities 3 months after you've had your first 2 shots. So it is the safest way. The thing that the issue that exercises my mind regularly as Health Minister is everybody has to catch it from somebody. So if we have, for example, older family and older relatives, if we have friends who are vulnerable, they're immunocompromised, we as individuals all have an obligation, not just for ourselves, but for all of those people who are likely or more likely to get the virus. We have an obligation to go and get boosted. And that's the Aussie way. Look after your mates. Go and get boosted and look after those people who might otherwise catch it from you. You might think, oh, well, I can't be bothered. I'm worried about having a sore arm, or I might have a day in bed, or I might be lying on the couch. Well, actually, it's Australia Day coming up tomorrow, and it's time to behave like the mates we all are. Go and get boosted. It will make a huge difference to how we manage this virus going forward. Thank you.
The Minister's noted it was 2 years ago today since we had our first COVID case in Australia, and since that time there have been impacts on our hospital system and of course on our community, and that extends to our elective surgery program. There's a report out today from the Australian Institute of Health and Welfare with regard to surgical performance across the country. New South Wales has continued to perform well. But that doesn't mean that there is not an impact on the people who've been on the receiving end of those surgical suspensions as we've worked through this period. As we said a number of weeks ago now, it is our absolute intention to resume elective surgery as soon as we possibly can. And we need to do that in a safe way, both for our patients and also for our hospital system. So we're looking at that very carefully this week. We will be working with our private hospital colleagues in respect of the resumption of non-urgent elective surgery. As we said, we were aiming for mid-February. We continue to aim for that date. The hospital system at the moment, I think, is doing nothing short of an outstanding job to manage the current cases of COVID that we are dealing with. We currently have around 600 patients that would have otherwise been in our hospitals, in private hospitals, a demonstration of the great partnership that we have with our private hospital colleagues across this state, and that is working very well, and we are very grateful to them for their assistance. Our ICU numbers have come down. We'll have more to say on that on Friday with respect to the model. And our hospital numbers have definitely plateaued. We're watching very carefully this week to see what they do next. We're hoping, obviously, that that downward trend starts from this week, which will give us more confidence with respect to what we do in terms of our elective surgery going forward. Can I say to the community, though, who have had their surgery disrupted during this period, our hearts go out to you. Please know that we're doing everything we can to get that surgery up and running as soon as we possibly can.
Good morning. I wanted to give you a quick update on our return to school plans. The first measure in our plan is to make sure that children who are sick do not come to school. So can I remind, as Dr. Chant has done today, if you do have symptoms, that is the time to stay home and to make sure you are self-isolating. Secondly, vaccination. We've heard again today how important booster shots are for everyone in the community. Around 85% of teachers are eligible for their booster as of today, and I urge all of our teachers across the state to go out and get boosted as soon as they can. Can I also remind parents, if your child is between 12 and 15 and they've had the first dose, make sure they're booked in for that second dose, and if they haven't yet been vaccinated, a child over 5, please make sure you book in and proceed with vaccination. Our rat surveillance programme continues to proceed at the military scale. 7.5 million rapid antigen tests are on their way to schools as we speak this morning. The data is still coming in from across the state about the deliveries of those rapid antigen tests, but I have been informed that 50% of schools in Sydney and North Sydney have received their kits already. And so, again, I ask both schools and parents to be patient. The kits are on their way, and your school will be in contact with you for when you can pick them up. This year, we will continue to ask our staff and high school students to wear masks when they are in the classroom. We are providing surgical masks available for all of our staff and for any student that needs one. And they were also millions and millions of masks out on the road being delivered to schools across the state. We are the only state that has checked the airflow in every single learning space across our public school system. We know that there is adequate airflow that meets the World Health Organization standards in every single classroom. Where that couldn't be achieved with natural ventilation, we have provided air purifiers into those classrooms, and we have more air purifiers going out to our schools this week to use in other spaces like staff rooms and first aid rooms based on the risk profile in that individual school. We are maintaining the settings from Term 4 that we know worked. We heard from a paediatrician on Sunday who indicated that their studies show that the mitigation measures we had in Term 4 were effective at minimising transmission of both the Delta and Omicron variants. So we are going to minimise mingling between cohorts. Schools will be looking at staggered start and finish times, and again I thank parents for accommodating those variations in school start and finish times wherever they are able to. And so we are looking forward to the start of term next week. I spent an hour or so talking to all of the principals across the public school system. I know that they are working hard to make sure that the start of school for our students feels as normal as it ever has done and that goes incredibly seamlessly. Our aim is to make sure it looks effortless to our parents because of all the effort that we're putting in behind the scenes. Thank you.
Good morning. I'm the Chief Psychiatrist, and I'm pleased to be back here this morning to talk about some of the mental health impacts of the COVID pandemic. We've all heard about and understand the significant mental health impact of the COVID pandemic. especially arising from the stress that's caused by the disruption and restrictions to our daily lives. Each new wave of the pandemic has brought its own challenges and fears and dangers. And processing these and making the necessary adjustments is emotionally and mentally draining. And I think today the issue of how to navigate a return to school is just another example of this. These things are genuinely stressful and can have an impact on people's mental health. If you're concerned about how to navigate that process of a return to school, it's important to talk to the teachers and the school representatives. If you're struggling to make good decisions in that regard, then you may need to seek some advice on how you're managing stress. Talk to your GP or contact Lifeline, Beyond Blue, the Suicide Callback Service or Kids Helpline. To those of you who are in isolation, whether you're COVID positive or a household contact, monitoring and responding to your mental health is every bit as important as monitoring your physical health. Everyone in New South Wales who registers a positive test with the Service New South Wales app receives the link to the New South Wales Health Information Sheet, which includes information about some mental health resources, including the Sonder Mental Health and Wellbeing app. I want high rates of help seeking to continue. We all need to stay vigilant and proactive with regards to our mental wellbeing at these stressful times. Since the start of the Omicron wave, we have seen some concerning signals that some people with serious mental health issues might be avoiding seeking acute care or attending our emergency departments. We saw this at the very beginning of the pandemic 2 years ago, and I understand why some people might feel that they're helping the system by staying away and delaying their access to care, but it's not true. Delaying or avoiding access to care for someone who needs mental health can derail the recovery process. If you are living with a mental illness, our services, as always, remain open to you, whether you have COVID or not. It's really important that if you need support or advice, that you do not delay accessing that care. To the families, carers and friends of people with mental illness, please continue to champion the importance of seeking ongoing support and advice even during the challenges with the pandemic. And finally, to all of us in New South Wales, keep making mental health a constructive topic of conversation on a regular basis. Once is not enough. Sharing our anxieties and challenges is important. The opportunity to talk makes a difference. And it's so important when someone admits that they're struggling with the stress and anxiety to validate their concerns. Thank you.
Dr. Wright, while you're there, can we just ask you, I'm trying to think of another time when Australia would have been through something as challenging in terms of its mental health as this. I'm going back to 9/11, perhaps. What sort of equivalence would our community have had to this last couple of years?
Yeah. Well, I think in terms of the duration, there isn't really an equivalence. But we have substantial lessons that we've learnt over the decades in relation to how facing disasters such as bushfires, floods, earthquakes and other natural disasters impacts the mental well-being and mental health of individuals and communities. And in Australia we have learnt a lot, and we've put in place a number of strategies and resources to respond, and those have been very much in play over the last 2 years. We will certainly learn more as time evolves, but we do actually have good evidence from past experience of dealing with disasters.
Have you ever seen it as bad as this?
Look, I actually feel that the response of the community and the mental health service system in New South Wales is something that I'm proud of. Certainly it's been challenging. It's incredibly exhausting for some of our staff to be working in these environments under these difficulties, but they know they're doing an important job, and they know they've got the support of the community, and they know their services are valued. So I think that we've got a lot to be proud of, but we are also learning a lot as we go.
Premier, let me ask you a question. Good morning. Normally, it's a legal requirement for parents to send their children to school. Day one, term one, will you be asking the Education Department to enforce that law? And is it correct that parents who want to keep their children home, perhaps if they have underlying health conditions themselves, could they face fines or legal action?
Well, I'll ask Georgina to provide some further information. What I would say is that we are doing everything we can to ensure that schools are a safe environment. We've done that over the last 2 years. Last year as well, we had a situation where we had to close some schools. We obviously don't want to do that this year. I appreciate, as a parent, that many parents across the state are anxious in relation to going back to school, but it is incredibly important for educational outcomes, mental health and social outcomes for our students and our young children. We know the opportunities that kids have are really set up by being in the classroom. Now, in certain areas, if there are young children who have underlying conditions, and we know that there are many students with disabilities across the state, we've tailored that support in those schools as well, and there is extra work that has occurred to ensure that those kids are safe. We would not be doing this if we believed that any student would be at risk. We've put our plans in place to ensure that kids right across our state are safe. I do understand that, and I saw some of the reporting last night, that, and I completely appreciate and understand that many parents are anxious, particularly those parents who have children with underlying health conditions. But what we have done here in our state, through the work with New South Wales Health, with the work with the Department of Education, is ensuring that our schools are safe places for kids right across the state. I'll just get George.
Can you just clarify, is it mandatory, Premier, for parents to send their children back to school?
Well, that's been the case. We obviously, we have a position in New South Wales where kids go to school. We've done everything that we can to ensure that our school environment is safe. We alongside the Victorian government, we have put in place, because of our capacity to do so, measures that ensure that we have the safest environment in the country for kids going back to school. That's exactly what we did. We set out those plans 3 weeks ago. We've worked tirelessly in ensuring that they will ensure that kids can return to school safely on day one. I understand there are concerns from some parents. That is completely understandable in the circumstance we face ourselves in. Our job as leaders and from government is to instill confidence in parents, in the wider community, that schools are safe. That's why we've taken the approach that we have here in our state. I'll just get George to provide some further information in relation to the operational side.
Firstly, can I say to all our parents that the best place for your child is at school. We know this for their own social, emotional and academic development, and we really would ask the vast majority of parents to make sure that their child attends school. Obviously, if you have a child who has underlying health conditions or you're concerned, it's likely your school is already aware of that and working with you, and we ask you to continue that conversation and dialogue with your school. They are there to support you. Our approach in the Department of Education is to work in partnership with our parents. We saw in our data at the end of last term, in Term 4 as we returned to school, attendance rates for Term 4 that were higher than 2019, so higher than pre-pandemic levels. So our data shows us that parents do want their children at school. That's where we'd like to see as many children as we can. And obviously we will take a sensitive and appropriate approach in working in partnership with our families through the start of this year.
Does that sensitive approach though involve potential for fines or legal action? Is that in the arsenal?
So our approach is to work in partnership with our families around individual childs. We've had case management teams in place through the department last year and in 2020 to really work with families and work out what it is they need to see and know in order to safely return their child to school. If they do have underlying conditions, then of course we arrange support at home or in other environments, and we have been doing that consistently, and we were doing that pre-pandemic. Those children were at school before the pandemic. There were times when a child going through treatment may miss a period of school, and we would of course support them to continue their learning.
Parents need to know, do they face a penalty or not?
Let's be clear. I mean, when we talk about parents being concerned, and many parents are anxious, particularly in circumstances where their children may have underlying health conditions, we're certainly not going to be fining parents. I mean, that's ridiculous. Our job, that's not a valid reason to not return to school. And as the Department Secretary has said, we are working very closely, our principals, our school leaders, the Department of Education, with parents right across the state. We're taking a common sense approach here. We're certainly not going to be fining parents who have concerns. We want parents to feel comfortable. As it's been very clearly set out, kids do better at school in the classroom. We know that. We cannot have a situation as we move through this pandemic, as we have over the last 2 years, be in a situation that we take away the opportunity for our children to succeed in life. We have to face into this challenge. We know that parents are anxious, but it's incredibly, incredibly important that we have kids back in the classroom. We will continue to deal, and as the Department Secretary has said, for those students who have underlying health conditions, the schools always work with those students, always work with those parents to provide that safe environment. That's exactly what we'll be doing again as we move through.
It's broader than that, though, due to the pandemic, though, because you may have families where adults in the family may have underlying health conditions. They're sending their children to school. Young children, it's not possible for them to be fully vaccinated yet. So in circumstances like that, there are some families who have sought meetings with the department, pandemic leave with their children learning from home for a few weeks at the start of the term.
And we will work through that with them. Well, we'll continue to work through that on a case-by-case basis. As Georgina has pointed out, and this will also occur throughout the year when we have certain, at time to time, students will need to isolate at home, either as a close contact or through COVID. And the online learning that we had last year will continue. We have built up that resourcing. It's been very successful over the last 2 years, but that will be the exception, not the rule. And that's important because, yes, we've ensured that for those kids who can't be in school, either through isolating or for whatever particular reason it may be, that those online resourcing is there to help them through their schooling. But in the main, the majority of students will be back in school. If there is a student with an underlying condition, if there's a parent with an underlying condition, we'll continue to work with you. This is all about coming together, working well together to ensure our kids get the best educational outcome and the best start to life. That's what the government is focused on. That's what we'll do, and we'll work sensitively with those issues as they arise. There is no doubt people are anxious. There is no doubt that there is concern as we go back to school, but we have to work hard to ensure that our kids are in the classroom in a safe environment, and we have worked tirelessly here with our government to ensure that we've created safe environments for teachers, parents and students. Except if there are issues from time to time, we will deal with them on a case-by-case basis. We're not going to be fining people for not sending their kids to school in circumstances where they have an underlying health condition or their parents may as well. And so I'll work through that with the Department of Education. This is all about building confidence, bringing people together and getting kids back in the classroom in a safe way.
Why did you decide to, why did you think it was necessary to continue the restrictions for another month?
We've always said that throughout the start of this pandemic, in fact over the last 2 years, it will always tailor the restrictions and the response and the measures to the circumstance we find ourselves in. And we've made some of those changes that were due to expire on the 27th of January. In circumstances, particularly I think where our number one focus is to get kids back in the classroom, we would expect cases to increase as we move through this period of time. I think it's reassuring, very reassuring where we sit with the capacity in the health system at the moment, but this is a cautious and measured approach as we move through this next phase. As Susan Pearce has spoken about, we did set out that plan to have non-urgent elective surgery back in the middle of February. We want to stick to that plan, and it comes down to priorities as well. So our priorities are kids back at school in a safe way, ensuring that we're able to deliver on bringing back that non-urgent elective surgery. Those measures are incredibly important for the state. They're incredibly important for kids and for people across New South Wales. And as we move through the next phase, we'll tailor those measures again. So where we need to make changes, we will. What we do want to do, though, is provide as much certainty as possible. We want to make as little change as we can as we move through. I think over the last 2 years, there's been times we've had to make changes, sometimes almost on a weekly basis over the last 2 years. We've tried to set out to provide as much certainty as possible. We've considered that the settings that are in place now are proportionate, measured and cautious for the situation we're in. We are very pleased with what we're seeing in the hospital system. We're also seeing as well the furloughed workforce of our health workers coming back to work, and that number is declining as well. So there are very reassuring signs, but this is a proportionate and cautious response as we move through this next phase.
So is the aim really to slow the spread? So the aim is still to drive cases down? Is this why you?
Well, we would expect cases to increase as kids go back to school, as mobility increases across the state. And whilst it's pleasing in the health system at the moment in terms of our capacity, which we've invested strongly in, this is the right approach for the circumstance we're in. We will always, as we've said, through the entire part of this pandemic and over the last 2 years, we'll tailor the response. But this is the right approach for the circumstances we're in, and they are proportionate measures that are in place. They're incredibly proportionate. When you look at singing and dancing, and I know that will affect some businesses, and you know, it's a pain for particularly many young people, but it's a small sacrifice as we move through the next month to ensure we don't have those mass spreading events. 2 square metres as well in hospitality is a small impediment, but ultimately it's also about instilling confidence. If our people are confident in going out, our measures have all been about, through this period of time, as we've moved through the last 2 years where we've had a highly unvaccinated population, and we've had to go through rolling lockdowns, to not go into lockdown, to keep society open, living alongside the virus. We're in a transitionary period. And the other point I'd make, Ash, is booster shots. Booster shots. It's very, very clear. It's very, very clear on the evidence that boosters ensure that when you do contract COVID-19, that your symptoms are less severe. Those in hospital and those in ICU, the numbers are much lower in circumstance we've had a booster shot. So this will also provide, as we move through this next month, will also provide an opportunity to get the eligible population who have received a booster shot to continue to rise above 40%. We want to get that rate higher, and taking this approach at the moment will ensure that we give time to people to get boosters, we get kids back in the classroom in a safe way, and we bring back non-urgent elective surgery on time.
But sorry, just one more. You've been so big on personal responsibility. So how can you justify keeping nightclubs, for instance, home and not letting people make their own choice in terms of if they have had their booster, that they can't go to a nightclub?
Well, we're not introducing any new restrictions. What we're doing here is maintaining the current settings that we have in our state as we move through this period, and that is the responsible and measured approach in circumstances where we want to get that booster shot up. We want to, and actually it comes down to priorities. I want there to be confidence in our parents. I want there to be confidence in our teachers that we can get kids back in the classroom day one, term one. That is a major priority for me and this government. In fact, that stands out ahead of the pack by a long way, and I need to instill confidence in parents that we can do so in a safe way. In addition to that, there are many people, as Susan spoke about, there are many people who have had to have, and this is not just in New South Wales, it's right across the eastern seaboard, and we did it twice during Alpha and Delta as well, in postponing non-elective surgery. If you were to ask what's more important, someone singing or dancing or someone getting their non-urgent elective surgery back, I know what the right approach is. And the right approach is to ensure we bring back that surgery as quickly as possible, that we get kids back in the classroom, and the measures that we have in place are cautious, yet they are moderate as well in ensuring that we get through this period of time. Over previous years when we've come out of lockdown, we've had 4 square metres in place. So the decision that we've come to as a government I believe is completely the right decision. It's completely proportionate to the circumstances we're in, and ultimately as well, we're keeping society open, we're keeping the economy open and businesses open, keeping people in jobs, and we believe the approach that we're taking today does that. As I said, we have to make decisions on priorities in the government, and to me and to the New South Wales government, getting kids back in the classroom, instilling confidence in the community, and at the same time bringing back that surgery are the key areas of focus for us right now.
It's going to have a massive impact on business, Premier, and yet we still have no business support package. Two questions. Is Matt Keane back from Christmas holidays? Secondly, tourist operators particularly are now saying they should be outputting potential list. They've been hammered.
Oh, well, I'll start with the last point. I mean, it's been a tough 2 years for tourism, particularly in the Sydney CBD. I mean, so many tourist operators, without having international tourism in our state. I mean, we're a global city. We're the hub for Australia. We're Australia's gateway to the world, and so many of our tourism businesses have done it hard for the last 2 years. We provided that financial support in the past, and we'll continue to do that. I know, and in fact, I had numerous discussions with the Treasurer yesterday, up to close to midnight last night. He is working very closely with stakeholders, with industry groups, to make sure we invest for impact. You know, and the discussions that I've had, Chris, with the hospitality industry is they're very supportive of the approach that the government is taking. They know as well, in order to get the balance right, it's making sure that you are instilling confidence in the community. If it's better to have a 2 square metre rule than to have no square metres, but not having the confidence in the community to go out to restaurants and bars. So it's really a balancing act here, as we've had to do over the last 2 years. Now, in relation to the business support, as former Treasurer, I've gone through this over the last, throughout the entire pandemic, and it's best to get it right. We understand the needs in the business community. It's better to be where we are now than to be in lockdown. Let's not forget, we have an opposition calling for lockdowns. We've had numerous commentators saying we should go into lockdown. We have kept society open as we've moved through this transitional period. Lockdowns crush businesses and get people out of work. That is not the approach we're taking in New South Wales with a highly vaccinated population as we move through. Having said that, we will provide support for businesses as we go through this period of time, and we've done that over the last 2 years. We've had businesses' backs over the last 2 years through all our support measures. We've provided more financial support here in New South Wales for our businesses and our workers than anywhere else in the country. And we've been able to do that because of our strong financial management, because of our strong economic performance in this state. That has meant we've been able to get businesses through some of the darkest and terrible days of lockdown. We are in a much better position today. There's no doubt, whether it's tourism businesses, other businesses that have struggled over this period of time, we're completely across that. We're working very, very closely. The Treasurer is working very closely with those industry groups to ensure that the financial support we provide will help get them through, just like we've done last year. And I want to make this point as well, because I know when being through this for 2 years as Treasurer, previously as Treasurer, there is always concern at this time, and I appreciate that. I appreciate business owners, small businesses particularly, who are struggling. But we've had your back over the last 2 years and will help get you through. At the start of Omicron, we had a 4% unemployment rate in this country. 4.2 in the country, 4% in New South Wales. That is incredibly encouraging. We were facing last year, and we talk about lockdowns, people calling for there are people across this state and across this country who 2 months ago and a month ago were calling for lockdowns. Lockdowns cause immense pain on businesses and families right across the state. And I know this as a former Treasurer, because we have people who can sit in certain jobs protected from the impacts of lockdowns. There are people who live day to day right across our state, and shutting businesses down and closing businesses results in people losing their jobs and not being able to provide for their families. And that's what we saw. That's what we saw last year when we had over close to 300,000 people lose their job in New South Wales. The decisions that governments make have substantial impacts on people's lives, and we do not take those decisions lightly. We'll always be there to provide that support. Success for me and success for this government is to ensure that people are kept safe, that people remain in work, and we keep businesses opening. That's been our success over the last 2 years, and that will be our success moving through this period of time. And to every business owner who's gone through a tough time, the government will always be there to support you. And I am incredibly confident, as going through the last 2 years, I'm incredibly confident that business will bounce back in this state, just like we had over the last 2 years with the support of the government.
What's the evidence that they are still effective, considering that you go to the supermarket, you get a message and it tells you that may have been in contact with someone who's monitored for symptoms. Literally every single person in New South Wales right now is monitoring for symptoms. How effective is it still that we are checking in?
Confidence. It's effective on confidence. We're not tracking and tracing. We made that very clear. If there's a high-risk venue, then that the health team in those circumstances may track and trace. But in the main, we are not. But it's about confidence. The reality is people feel confident checking in. And our job as government is to instill confidence in our people in the circumstances where we have a highly vaccinated population to go out, to enjoy the best that New South Wales has to offer in a way where you keep yourself, your friends and your family safe. And people are doing that right across New South Wales. So checking in, and we had I can tell you we had a robust discussion and debate on this exact point, because Kenny, the arguments you make in your question make complete sense. But on reflection and debate, we all came to the conclusion yesterday that the best thing we can continue to do in this state is instill confidence in our people. And the reality is, for a lot of people across New South Wales, they feel confident checking in. And if that provides the confidence to people to go out, to visit retail, to go out to the pub, to go out to the restaurant, then we'll keep them in during this period of time. And that's been key. Going through the last 2 years, confidence is key to the state bouncing back. That's what occurred over a 2-year period of time. That's what we're going to see again. And there were dark days over the last 2 years when we were in lockdown, and for some people and for some businesses it felt like we would never get out of it. But we did get out of it. Our state has come through the last 2 years incredibly strongly, and we're going to come through this period of time as well. And our job is to provide that confidence in our people. And to Ashley's question in relation to some of these restrictions, I believe the maintenance of these measures we have in place for the next month will actually drive economic activity, not impede it. Because by instilling confidence that the measures you have in place will have people go out to bars, have people go out to restaurants and cafes and to retail by checking in, then that's a great thing. And I even can sense now, just in the Sydney CBD, over the last few days, confidence is returning, and that's incredibly positive as we move through.
Premier Mark Latham has claimed that a member of your cabinet was leaking against you. Do you have 100% trust in your cabinet that they're not leaking?
Yeah, absolutely I do. I mean, we have... I've always found it strange that there's a sense that people in public life shouldn't have different opinions. I enjoy, and the time that I've been Premier and Treasurer and Finance Minister, the robust discussions we have each and every day in Cabinet committees in the party room, whether that's in Cabinet, Expenditure Review Committee, Infrastructure Committees. They bring out the best and ensure you get the best public policy outcomes for the people of our state. You don't want a situation where you've just got a bland group of people sitting around a table without opinions. What you want in a good cabinet discussions and debate, what drives better public policy for the people of our state, is is robust discussions, fresh ideas and different perspectives. That's what we have in our cabinet. And from time to time, opinions get put out in the media. That's fine. What I can say is that every single person in our government is focused on one thing, and that's getting our people through this difficult period of time, just like we've done over the last 2 years. I've sat in cabinet meetings for 8 years and disagree. Almost every cabinet meeting I'm in, I'll probably disagree with people. I've disagreed with the responses throughout the last 2 years at periods of time. Doesn't mean I'm right. Ultimately, getting a lot of good people together, critically thinking about issues, having different opinions is a really good thing. It shouldn't be seen as a bad thing. It should be seen as a great thing. And we've got very smart people, very good people in the New South Wales government, in our cabinet, that have robust debates from time to time. And I'm very proud to lead a team who have those discussions, end up landing on a position and moving through. And ultimately in a pandemic, it's always criticism of government decisions. It's criticisms of governments overseas. There's criticisms of the federal government here, or of state governments around the country. But ultimately, whether it's a Labor government or a Liberal government, everyone is focused on one thing, and that is getting our people through this. And if we take a step back, as I've often said, and focus a bit more on unity rather than division, and focus on the fact that from an Australian perspective, compared to anywhere else in the world, our response as a country, whilst it differed from time to time across states and to some degree still in relation to Western Australia, ultimately, from a health perspective and an economic perspective and a social cohesion perspective, Australia has done incredibly well. And I think as we come in and celebrate Australia Day tomorrow, an important day for our nation, where we reflect on the values that make our country great, we should be incredibly proud of what we've achieved over the last 2 years and have complete confidence that that spirit and those values working together will get us through this next period.
Last one.
What is your final push on radio this morning? Are you saying that this could likely be our last set of restrictions in New South Wales? But before we move towards what the WHO has very promisingly said overnight is end game?
Well, one thing I've learned in this pandemic is you just don't know what's coming next. And our job as a government is to continue to prepare for the future. We've done that at the outset in relation to our investments in the health system here in our state. $4 billion when I was Treasurer and Brad was Health Minister at the start, and we invested heavily, mightily in our health system to prepare it going forward. Our vaccination rate and booster program continues to roll out. But I have said from the outset, and this government has always taken the approach, that we will tailor our measures to the circumstances we find ourselves in. So we believe today's decision is a safe and cautious approach to the situation we find ourselves in, but we will obviously continue to adjust as we move through. But I'm very confident. I mean, look, what's come through the World Health Organisation is pleasing. It's reassuring, and it should provide reassurance to our people, because it's common during the pandemic over the last 2 years that in the main it's very easier in media reporting to focus on the negative, to not focus on the positive. So there are very pleasing signs. That doesn't mean it's time to rest on our laurels. That's why we've made the decision we put in place today. But if you go through the last 2 years and you look globally around, for example, take death rates in other countries much higher than ours, and then you go through this next period of time, what has clearly protected the people of New South Wales and the people of Australia has been that high vaccination rate. And if we can keep that effort going as we move through, I'm incredibly confident that we'll continue to remain strong, both on a health position and an economic position. But we should always remain cautious. As we move through this next part of the pandemic, because we just don't know. We don't know. No one foresaw Omicron coming on. No one foresaw Delta coming on. So what we need to do as a government is continue to prepare for what may come next, plan for the future, and ensure that we keep people safe, we keep society open, and by doing that, we'll come out stronger, just like we have over the last 2 years.
The Victorian advice is you can get a booster shot immediately after your 7 days of isolating if you feel well.
We'll ask Dr. Chant to speak.
I think the key thing is that doctors will go to the ATAGI advice, and ATAGI reduce the interval to 4 months in terms of the likelihood of reinfection. I think we're being pragmatic that by giving a simple message that when people are well, so generally people have COVID, but many people are a bit fatigued of the next two to 4 weeks, we're just giving that guidance of 4 to 6 weeks. In terms of priority, I have a greater priority on getting those people vaccinated who have not been just recently exposed to or had confirmed COVID. The reason is that getting confirmed COVID is like being boosted. So it's in essence like being exposed, your immune system responds. So that's why we're just being pragmatic, and I've said this at previous conferences about saying 4 to 6 weeks, but talk to your own doctor, because your own doctor will make those individual assessments. But as guidance, you don't need to delay, but when you're recovered, and we're just giving that simple message of 4 to 6 weeks. So I don't think there's difference, I think it's just the way you say it. And ultimately, we know that reinfection in the short term is unlikely. Clearly there is concerns that you could get Delta and Omicron. We know that our data is showing that Omicron's the majority, but that's probably the minor consideration. But we think therefore 4 to 6 weeks is just pragmatic, that most people will have recovered fully through that, and it's just an easier message to get out.
Minister, just on elective surgery, Susan Pearce referred to the national data that's out today. In that data, it shows that the increase in waiting times for elective surgery has increased more in New South Wales than other places, or the national average. Why is that?
New South Wales is the biggest state and has the most number of people. But what we do know is that after each of the periods that we've now experienced the last 2 years, New South Wales does everything possible. Our health team works very hard to bring down the people waiting for the elective surgery. So I think I have absolute confidence. Having been the health minister for 5 years, we have an amazing health workforce, and they will do everything they can to bring those Category 3 and partially the Category 2 waiting list down. Thank you, everybody. Happy Australia Day tomorrow if I don't see it. See you all later.